In interstitial atresia, there will be always a bilious vomiting with abdominal distension. This will happen in first 2 days of the life. In case of duodenal atresia, initially in the embryological stage, the duodenum having a thick inside wall and lumen is very narrow. And when the duodenum get mature, this area get canalized. These cells over here get removed and it is well canalized. So this process is absent in case of duodenal atresia, and this canalization is absent in the area below the ampulla of water. So it is the place where bile released into the duodenum. That area is not affected. So there will be a construction below that area. So during the vomiting, the vomit contains the bile. That is why we have the bilious vomiting in case of duodenal atresia. And this patient is having a double bubble sign, which is shown here in the X-ray. This is the distended stomach, and this is the area where there is no recanalized. So this duodenal atresia is commonly associated with the Down syndrome. Let us go through some pictures to get more clarification. This is the duodenum and this is the stomach area. In case of duodenal atresia, there will be a more number of cells over here near the prosmial area. So this area will get the dilated along with this one. Since here this portion is narrowed due to the pyrolic sphincter, and this area is not have any problem in the distal portion of duodenum. Let's look at another image. In this image, we can see a duodenal atresia over here, and here they receive the bile. So when they vomit, they will give out the bile. The patient who having the jejunal and ileal atresia, there will be a disruption of mesenteric vessels, especially the superior mesenteric artery. As a result, suppose this is the interstitial area, and if this area is supplied by the blood vessels, and if it is blocked over here, this in the embryological age, this area will not get any blood supply, so there will be less development over here. So this lumen get immature and narrowed, and if it is very severe, this gets separated atresia and undergo atresia. That atresia means that there is no proper passage. Passage will be closed, and there will be atresia, and there will be a apple peel appearance on the remaining portion. The large portion of ear will be lost, and the remaining portion present over here will be like apple peel. The patient who having the jejunal and ileal atresia will have more air fill level in the stomach and the prosmial part of the duodenum. So air fluid level will be high in this patient. Interstitial atresia, we have different classification. In type 1, there will be a narrow lumen. This narrow lumen is due to there is no enough blood supplied from the superior mesenteric artery. So this lumen get narrowed, and if there is a further loss of blood supply, this area undergo atresia, and further atresia or further stenotic lead to complete atresia of this area. And in this image, they show the apple peel appearance on the chest X-ray. Okay guys, that's all about the atresia.